Now, following the detection of COVID-19 cases in Togo, the government put in measures at the southern border to improve early detection of the virus. Aside from the installation of a thermal scanner and provision of thermometer and protective gears, officials of the border agencies have been duly trained. JoyNews' Fred Kwame Asari was at the Ghana-Togo border in Aplao and has filed this report.
It's a busy day here at the Ghana-Togo border in Aplao in the Ketu South municipality of the Volta region. As usual, travelers are crossing to Ghana while others are making their way into neighboring Togo. However, there has been a change in operations here following a detection of a coronavirus case in Togo. The Aplao Sector Commander of the Immigration Service, Chief Superintendent Fred Dwedu, outlined measures being taken at the border to prevent the spread of the virus into Ghana.
What about the equipment and other logistics that we need to also support whatever education that they have given us? They initially gave us some hand sanitizers, some gloves, some nose masks, which of course wasn't enough, but we need to make do of what we had then. Then afterwards, we had to contact our headquarters, Accra, immigration headquarters in Accra, also to inform them about the insufficient logistics that we will have. So quickly, they arranged for some of the equipment for us, the gloves, the sanitizers, the nose masks, and those things. So quickly we brought it, and then we distributed to our officers for use. So any officer who is on duty must be with those items.
Officials of the various border agencies here are on high alert. A thermal scanner has also been installed at the border health post to help identify travelers who may be infected with the virus. Each and every traveler crossing into Ghana from Togo is compelled to go through a screening process at the border health post. The thermal scanner system, we were told, would give a signal if it detects a traveler with a temperature of 37.5 degrees Celsius or higher, which is a common symptom of a coronavirus infection.
So the service, also what we have also done is to instruct the officers that every traveler that is coming into the country should go through screening at the Port Health. Everybody who is entering the country. Yes. So if you look, we have put some officers under the arc, so that those times some of these locals who stay here and go and do business here and come. At times when they are coming, because they know them, we allow them to go. Yes. At this time, if the person has moved from Aflao or whichever community, in the Volta region, and gone to trade in Togo and is coming, you don't know who and who have gone to contract the thing. So now all of them, they all go through the screening.
However, there's a great risk of the virus spreading into Ghana through the numerous border communities and unapproved routes.
Yeah, it is one of the challenges that we are facing as an agency, because it is Port Health who has to go and maybe go and station some of their personnel there. Yes, it is a record which I think will draw the boss' attention. Yes. Kologa alone. That is where the planted thing is. It is a whole community, a very big community. So when you go, you will see that both the women and the school children, they are crossing to go to school, and then after school they come back. Their wives, their men too, they go there, go and trade, then they come back. Like we are saying, if they go there and they go and contract something, how do we check it? You see the point? So I think it's something that, yes, we will draw the attention, and then quickly something should be done about it, so that some of the personnel can be sent there.
Nonetheless, the municipal chief executive, Elliot Agbenowu, assured.
I'm sure by now many of you are trooping to pharmacies and shops to get hand sanitizers, but you may want to check the alcohol percentage because Dr. Michael Owusu, a researcher with the Kumasi Center for Collaborative Research, is warning substandard sanitizers will not work.
Also buy absolute alcohol. You have 2.5 liters of absolute alcohol and prepare your own 70%. So if you have an alcohol which is about 100%, you can take 70 ml of the alcohol, add 30 ml of ideally distilled water. But if you don't have that one, you can, it's possible to use ordinary water, mix this, and then use it. Either medical supplies. You want to talk about absolute ethanol or isopropyl alcohol. They will get this for you. And if you check the label, it's mostly 99.8%. So once you get this, you know that what you have is absolute. You yourself can prepare your 70%. If you want 100 ml of that, just take 70 ml. You can measure. If you have a bottle with labels, measure, add 30 ml of water, and this is enough to protect you. That is when, if you think that getting the alcohol base is difficult.
A researcher at the Kumasi Center for Collaborative Research, he says resources made available by government places Ghana in a position to build modern treatment centers for coronavirus. Dr. Michael Owusu, firstly, he says is calling for deployment of portable test kits at the country's borders to screen people for coronavirus. He says all emergency response measures must include support to research institutions to increase their capacity. Dr. Michael Owusu has been speaking with Love FM's David Akwete on Love in the Morning. Nanaya Ojima has more in the following.
Dr. Owusu says all emergency response measures must include support to research institutions to increase their capacity.
What I will expect is that this scenario should also give us an opportunity to build state-of-the-art centers to deal with infectious disease and outbreak. ICU infectious disease is one of the places you will want to set up and then build. But our system has not been tested. And if you have not been tested, you wouldn't know how to deal with these cases unless it comes. But you don't also have to wait for these cases to come and cause people to die. So what it means is that the money will have to be in. The KCCR must have its own share of the money. Noguchi must have its own share to boost testing capacity and buy a lot of the equipment, train people, deploy this equipment for people to do the testing. A portable testing device which works without electricity, which can be deployed at the borders of Ghana for this testing. I saw it and I was so much happy. This machine, together with the reagent, will not cost more than $11,000. So you will expect that if you can buy 10 of these and position them at various borders and even make it available to the public health laboratory.
Dr. Owusu and his colleague, Dr. Augustina Silverken, believe there is no need for panic since the 2 confirmed cases are what they describe as imported. They stress high level of personal hygiene, especially continuous hand washing with soap.
So this way, so you flex your arm this way, and then you sneeze or you cough into it. You can also do this. So I say you catch your cough or you catch your sneeze. So you close your 2 palms and then you sneeze or you cough into it. But you know, this is where the hand washing bit becomes very important. Right after sneezing or coughing, you have to go straight to a tap running clean water with soap and then wash your hands for at least 20 seconds. And I think that you may even want to limit talking because the virus is such that it is transmitted via aerosols. So as you open your mouth to speak, a lot of things will come out of your mouth and you don't know what is even coming out of your mouth.
So you need to wet your hand first. You have some water, you wet your hand, and then after that you take your soap, rub it around within your hand. And if you look at my hand, in between my fingers, you could have microbes stuck within there. You see, I'm putting on a ring, so I have to take off my ring, put it somewhere, because microbes can get stuck in the ring. If you have chains around your hand, you don't have to wear it whilst washing. It's good to put them somewhere. And then once you have your hand washed, in between your fingers, at the back, you see, at the back also you have to make sure that it's clean. And then within, so anytime you do this, you see that the palm inside is kept
where the lines are.
So where the lines are, you can have microbes hiding there. So you need to make sure you do something like this. Those on Facebook can see me now.
Yes, they can.
And then they do that. And then also your thumb. So you could have microbes also hiding here. You need to make sure that you hold your thumb, you rub your hand around it. Then after that, you open your tap water, and then you wash your hand and make sure that it runs out. But then remember that once you finish washing your hand, you need to take a tissue to close the tap.
The two researchers are, however, drawing attention to substandard sanitizers, some with alcohol content below recommended 60% base on the market. They urge the public to consider preparing their own sanitizers.
Any either medical supplies, you want to talk about absolute ethanol or isopropyl alcohol, they'll get this for you. If you check the label, it's mostly 99.8%. So once you get this, you know that what you have is absolute. You yourself can prepare your 70%. If you want 100 mils of that, just take 70 mils. You can measure. If you have a bottle with labels, measure, add 30 mils of water, and this is enough to protect you. That is when, if you think that getting the alcohol base is difficult.
For Joy News, Nana Ojima reporting.
The Ashanti Region Health Directorate says the region has received an amount of 52,000 Ghana cedis as the first tranche for the fight against coronavirus. Officials say the initial money will be used to prioritize the purchase of non-contact thermometers for the health professionals. Regional Health Director Dr. Emmanuel Tenkron revealed the unit has reactivated the Public Health Emergency Committee, which is multi-sectorial to support the fight. He has been explaining to Love FM's Prince Tapia.
And in Ashanti region, we're also working very hard. We've divided our preparedness into various strategies. The first is what we call the coordination. The coordination, this is the center for the coordination, so that all activities, as far as the Ashanti region is concerned, will be coordinated at the Regional Coordinating Council here. And then the regional minister will be the incident commander.
It is part of the moves by government to strengthen its preparedness in the regions to contain any possible case if recorded. Dr. Emmanuel Tinkran says all district hospitals in the region will be holding centers, while the Kumasi South Hospital will be equipped to serve as a treatment center.
As far as funding is concerned, you heard that the government has released some money, and Ashanti region has also been given part of the money. For the meantime, we will want to use the money to buy non-contact thermometers, so that when our nurses are taking temperatures, then they can rather use that one. At least if only we are fortunate enough to get it. Now, you know, because the demand for everything is so high, you can't get anything. But we are hoping that we will get it. But that's what we plan to use the money for. If we get, we are hoping that we will get it. The money comes in bits and pieces. So, for instance, yesterday, the spreadsheet that I had brought in 52,000. But I know that, 52,000 Ghana cedis, just initial money that has been allocated here. But we have been promised that now they are doing the distribution. So we'll get it in bits and pieces. As it comes, we also get. But I know the chunk of the money has been released to Ministry of Health, and they are also giving us some. They are also using some for the national programs, risk communication, printing materials, a whole lot of things that they are also doing. So we also get our part and do what's supposed to do, please. But we will basically start with the risk communication. So what we plan to do is that every week we will give a press briefing here from 9:30 to 10 o'clock Mondays. You can come, and then if you have any issues, we will support you. And in Ashanti region, we're also working very hard. We've divided our preparedness into various strategies. The first is what we call the coordination. The coordination, this is the center for the coordination, so that all activities, as far as the Ashanti region is concerned, will be coordinated at the Regional Coordinating Council here. And then the regional minister will be the like the incident commander,